why I'm again here.
Okay, I see. Can you please tell me what is your problem exactly?
Okay, so doctor, I've been having these low moods for 2 months now. Okay, and I had it's actually more than 2 months, and I visited a GP who referred me to the psychiatrist 2 months back, and I was started on the talking therapy that you guys advised. But it's not helping me, and I'm really worried. I don't feel good at all. So I want if there is anything else you can offer me.
Okay, I understand. I just want to know the talking therapy. Can you please tell me how many sessions did you attend?
Yes, I have had 4 sessions up till so far.
Okay, I see. And now, can you please tell me, we'll talk about more about your low mood. So, can you please tell me in the past 2 months, have you felt like you have been feeling hopeless or lost any interest in any of your activities?
Yes, definitely. It actually the first time I came was because of my low mood. I had lost interest in my daily routine. I had stopped going to my work. And the psychiatrist advised me with the talking therapy. The initial 2 sessions, I started going to my work again. But after the second session, I started feel low again, and I am even losing interest in my sleep and in my appetite, and I'm not going to my work again. So it's definitely not helping me.
Okay, I see. We'll definitely take care of you. We can offer you some other things that can help you with this problem. Don't worry. I just need to ask you a few more questions. So besides this low mood, when this lack of sleep and appetite, have you been experiencing anything else?
Yeah, sometimes I feel like I need to cry a lot, and I don't know if I can cry or not because it's not usual for males to cry. So I just don't know what to do. But I feel like crying all the time, and I've stopped going with my friends. They try to call me and contact me, and they want me to come with them, but I try to avoid them, and I usually don't pick up their calls, and I'm mostly at home. So yes, I don't know what to do.
Okay, I see. And besides these low moods and these past 2 months, have you ever felt sometimes that you have a lot of excess energy or that you become impulsive?
No.
Okay, that's good. And can you please tell me sometimes people, when they have low moods, they can think about, they can have harmful thoughts like hurting themselves or hurting other people. Has this been the case for you?
No.
Okay, that's good. I just want to ask you, by any chance, have you ever been diagnosed with any medical condition?
Yes, I'm diabetic.
Okay. And how has it been managed?
Yes, it's been managed with diet, and I try to control it with my diet.
Okay. And are you allergic to any foods or any medication?
I'm allergic to penicillin.
Okay. And by any chance, do you take any long-term medication?
No.
Okay. And do you have any family history of any mental illness?
No.
Okay. I just want to ask you a few more questions about your lifestyle. Now, you told me you don't have any more energy to go out with your friends and you cry a lot. By any chance, do you have any support system in your family or your partner?
My partner broke up with me 2 months back, and I have friends around, but no family. But I don't want to meet them.
Okay. Can you please tell me why you don't want to meet your family or your friends?
I just don't feel like meeting them. I just try to avoid them all the time.
Okay, I see. It's okay. Lucy, sometimes when people they have low moods and they don't have any kind of support system, they can resort to alcohol and drugs to help them cope with these symptoms. So has this been the case for you?
No.
Okay, that's good to hear. As part of our assessment, Lucy, I would like to examine you. So I'll just like to check your blood pressure, your heart rate, your temperature, and your pulse. And I'll also like to check your blood sugar and do a neurological examination. Okay.
Everything is normal.
Okay. Now, before we proceed, I know you told me you want some other treatment and some other thing to help you with this slow mood besides the talking therapy. Is there any other concern that you're worried about?
I don't know. I just want to know if anything can cure me or not, because I'm definitely not happy with this therapy and I don't want to take any more sessions.
Okay, I understand that. So, Lucy, since you've been having the talking therapy, I can assume someone has talked to you before, the specialist, about the diagnosis you have.
Yes, they told me I have depression, but this therapy is not helping me with my depression. I don't know what to do.
Yes, exactly. It seems like you have depression. So one of the things we can treat it is offering talking therapy. As this has not been working for you and you still have low moods and low energy, we would like to offer you some tablets. They're called antidepressants. Okay, that should help you with your symptoms. Are you following me so far?
Yes, okay.
Okay, so these tablets, you're gonna have to take them for about minimum 6 months. They take about 2 to 3 weeks so that you can notice an effects on them in your life. So after 2 weeks of taking them, you're gonna start having good moods and you're gonna start having experiencing more interest in your activities and you're gonna notice a change in your behavior and in your mood. Okay?
Oh, that will be great.
Yeah, of course. We can start with that. So, like I said, you're gonna have to take them for 6 months to have the maximum effects on them, and it would be ideal if you can take them with the therapy. I know you said the talking therapy does not work for you, but the results show that these medication work best when they're combined with the talking therapy. Can you try doing that?
Oh God, doctor, I'm just sick of this therapy. I don't want that. Maybe only medications can work with me.
Yeah, of course, it's your choice. It's just an option that we offer to our patients. If you feel like the talking therapy, you don't want to do it anymore, we can offer you the medication only.
Okay, that's great.
Okay, now I'll prescribe you the medication, and I would like to see you in about 2 weeks just to see how well you're doing. Okay?
Okay, that will be fine.
Okay. If you have any concern or any other question, please feel free to come back to us.
Sure.
Okay. I hope I was able to help you today.
Yes, thank you. Your time is up.
Thank you.
Okay, so Dr. Ayman, it was a good performance. What do you feel yourself about your performance?
Uh, I don't know. I feel like it was okay. I have a
Uh-huh.
problem with the like addressing patients' concerns and mentioning does he have any birth concern. I feel like you kept mentioning to me so many times that you don't want to talk in therapy. You talked about it by maybe 3 times or 4 times,
Mm-hmm.
and I feel like maybe I could have addressed that sooner instead of leaving it to the management because the patient maybe kept bringing it up, so it's bothering him a lot.
Yeah, yeah, maybe sometimes the patient tries to like drag you on some other pathway, like I was doing, dragging you towards the CBT, and definitely talking about the therapy again and again was actually to enforce you that I don't want this therapy and you need to give me something else, okay? But the way you handled it was good, actually good. And I could see that you were using quite good sentences for the IPS, and you were actually empathetically responding to my needs and also to my emotional status. But one big thing that you missed in this consultation was grading the mood. In the depression scenario, you always have to grade the mood. Okay, if I am presenting you with low mood, then you are supposed to ask me, okay, so for the past 2 months you have been having this low mood, so what was the scoring of your mood back then and what is the score right now? Only after the scoring you can confirm that this depression has worsened or not. Okay, because maybe
Okay,
I
yeah.
was having this difficulty with the appetite or sleep as well 3 months back, but I didn't inform you about that because you were not the doctor 3 months back and you don't know exact details about that time, right? So by the
Yeah.
comparative scores of two low moods, we are going to classify our depression that either it is being helped by the talking therapy or it is getting worse. Okay, so this was one
Okay.
important thing, and always in any I try to mention to all my candidates in all my sessions that in the elderly scenarios where someone is having chronic condition like chronic pain or anything, in the psychiatry scenarios, and in the like teenagers scenarios presenting with some kind of problems or maybe LGBT issues, always ask about their mood, always rate their mood. Okay, it helps you act as a more concerned and more empathetic doctor who is trying to like address every possible way, in every possible way, that how to make my patient feel comfortable and good. Because if you are not addressing my mood score in a depression scenario, then definitely it is not a good sign for you, right? So
Okay.
definitely,
Yes, yes,
yes,
that's
yes. So this was a major point that was missing in your consultation. Otherwise, it was a very good attempt, and definitely since your exam is quite far away for me, but you are quite well prepared, I must say. But there are a few things that I would like to add to your consultation, and you are definitely good to go and pass this exam in the first go, definitely. So thank you so much for performing, and let's just have a quick feedback about how did you perform and what more we can add to it. So this
okay.
scenario,
Thank you, doctor.
you're welcome. Okay. So this scenario, it was a follow-up depression scenario, and it is one of the common stations that comes in our exam. So how to proceed with this scenario? Regarding the grips, definitely introduce yourself, ask about the details of the patient, and then preferably ask what the patients want you to like call him. By which name does the patient want you to call him? So definitely you would say, okay, you can call me Lucy or whatever. So you will be proceeding with that name. Always ask with that. It is more of you building a rapport with your patient, as well as you should also be like it is you building the rapport with your patient, and this is how the examiner will know that okay, she is very much or he is very much considerate about the empathy and about how to like involve the other patient well in the conversation. So always try to ask about their priority. Then he would be saying, okay, it's a follow-up. Usually in the follow-up consultations, try to save your time by telling a brief introduction yourself. Okay, so I can see from my notes that you have been here before and you were like classified with mild depression and you were started with talking therapy. Is there anything else we can help you with today? Or do you feel like you want to talk to us about anything today? Because it is a follow-up appointment and you definitely know why the patient is here. So before asking his concerns, just quickly review a brief portion of the details that is given already given to you in the scenario, just to save your time and the patient's time. Because if the patient goes into the detail, then definitely you are going to lose time for the management. So if you quickly narrate, okay, I know this about you. Do you want to add anything else to this, or how do you want to proceed today? Do you have any concerns or what brought you here today? Okay, so asking about the current symptoms, then he would be talking about, okay, this is happening and I'm really worried because it's not helping me now. I've been starting on the talking therapy, but that therapy is not helping me. Okay, so you are saying that this therapy is not helping you. Can you please tell me how have your symptoms changed? So what were the symptoms back then and how have they worsen now, or maybe they are better, or what stage they are on. So do you think anything is added on? Instead of narrating each and every symptom yourself to the patient, like, do you feel any loss of interest, or do you feel any change in your appetite or any sleep, just ask openly. Do you feel that your symptoms have worsened in any way? Or maybe do you feel what bothers you and makes you think that this therapy is not helping? And then asking about the score of mood. So how was your mood back then? Can you score it now? So what was the score back then, and what is the score now? This will make you understand that, okay, talking therapy is not helping him, and definitely his depression is worsening now. And only then, if the talking therapy is not helping and his symptoms is worsening, only then you are going to go towards the medications. Because sometimes, because talking therapy takes a lot of time, okay, and sometimes people are just impatient. But you as a doctor are the one to decide and categorize depression, and then advise about the treatment. So if the patient is in mild depression, is still in the mild depression, he has taken only 4 sessions of CBT, then it is not wise for you to start him on antidepressants right now. You would convince him for like going for a few more sessions, and then maybe we can decide. But if you are clearly seeing that this patient, his mild depression has worsened to moderate depression, then you are going to step up in the treatment and offer him some medications. So all of this is very important to categorize that whether the depression is still mild depression or it has worsened to moderate. Then details of the CBT. What kind of therapy you are having? How many sessions have you had? Did you have any difficulty in it? And don't you find anything helping in it? Why do you think so that it is not helping you? Okay. So there are 2 types of CBT sessions. One is private and one is group. So sometimes people are taking private sessions that they are not enjoying it. So maybe asking about the type of CBT is important, because you can address it and use this type thing in the management part and convince him on taking the CBT. And that I will be discussing in the management part, that how can you use the CBT type and then offer him to continue CBT in some other form. Then rate the mood, very important. Suicidal intent, very important. You cannot pass a psychiatry or a depression station, especially, without asking the suicidal intent. Then famish is the general PMAFTOSA that we usually follow in other scenarios. Famish is for psychiatry scenarios, and you ask about the family and the support, finances, any medical history, any medications he's on, any social history, which includes the drugs or alcohol, also smoking as well, and any other symptom that he wants to talk to you about. Okay. And at the end, hallucinations, any kind of hallucinations or any kind of bipolar symptoms if the patient is having. Also try to rule out bipolar, like Dr. Amen did, by asking about any extra energy you feel, or any kind of listening to voices, or any such symptoms. Okay. Then about the eyes, she did it very well by asking about my concerns. You can also ask about, okay, what do you think why do you think that this therapy is not helping you? It could be the idea in the eyes. So you will be marked for it. And then, since it is for quite long time, and definitely it is affecting his life because he's not going to work. So how is it affecting you? Which he has already told you that he's not going to his work, he's not visiting his friends and family. Okay, then definitely about the examination, all the vitals, also general physical examination and neurological examination. So diagnosis. You have to say one clear-cut sentence for the diagnosis to secure the mark for it. Otherwise, you will not get the marks for it. So unfortunately, since your mood has worsened and this symptom has added, I must say that your mild depression has progressed to moderate depression, and the CBT alone doesn't seem to be working for you. Okay, so you have to categorize it that your mild depression is progressed to moderate depression. This is the diagnosis. Then coming to the management. In all the cases, always order all the baseline investigations to act as a safe doctor, because maybe it is something related to thyroid that is going on, and maybe you skip it without getting the baselines done. So always order all the baselines for the patient. And also, if you are starting someone on medications, definitely you want to have the baselines done in order to know his status of the kidneys and liver and everything. So always order all the baseline investigations as the first part of the management. Then since the talking therapy is not working for you, how about if I start you on some medications we call selective serotonin reuptake inhibitors? That is a kind of antidepressant medications. What do you think about using them? Ask them, involve them in your management. Do not just narrate them, okay, I will be prescribing you these medications and you have to use it. No. How about if we start using some medications, which are this? And also, when you are prescribing a new medication and you know that there are a few side effects regarding this, so you can, if you have time and if you remember, ideally mention that to the male patient that there could be some side effects, including erectile dysfunction with these medications. And if you find this troublesome, then you can definitely come back to us and we can change the drug. It takes 2 to 4 weeks until you are going to feel the effect. And that is why we want you to continue the CBT along with the medications, because studies suggest that the CBT and the medications go more well hand in hand. So if you are taking the two steps together, then definitely you are having more benefit. Try to convince him instead of just surrendering, okay, if you don't want it, don't have it. No, it is our criteria for the moderate depression that you are supposed to start the patient on the CBT as well as SSRIs. The patient cannot decide for himself that, okay, this is not working and I am not using it. Just try to convince him in any way possible. Okay, if you were using a private session for your CBT, how about if you start taking CBT in group where you can find other people who have similar symptoms to you, and maybe you can talk to them and find ways to cope with your life and maybe making new friends. This is a very good sentence in trying to make the person go for the CBT, because this management is not complete without CBT plus drugs. You cannot just mention, okay, take the drugs and leave the CBT as you don't want it. No. We are supposed to prescribe both the things because they go well hand in hand. Okay. Then CBT continued, whichever type they want. But you have to continue. Try to convince them. Then crisis card. Why crisis card? Because they can have suicidal intent while taking the antidepressants. In the beginning of taking the antidepressants, people do have some suicidal ideation. These are one of the side effects of the SSRIs. So always give them a crisis card. Mention them if you feel like giving up, or if you feel like you are going to harm yourself, or if you feel like that nothing is going to work for you, then this is the crisis card and this is the number you need to call immediately and we will come helping for you. And then at the end, leaflets, because we don't have much time. to explain all the side effects, and mostly we do not remember the side effects of all the medications. So just quickly say it. Okay, so since I'm starting you on a new medication, there may be some side effects of this medication, which I'm going to offer you some leaflets, and you can read them side effects there. And even then, if you find anything questionable, then definitely you can come back to us. How does that sound to you? Always ask their opinion. What do they think about their management? Will this thing work for them? Okay, so this is how you are going to involve the patient, as well as try to encourage him into CBT as well as SSRIs. Okay, and then definitely arranging a follow-up 2 weeks later to see how good the medications are working. And then definitely it is a very important point to mention about the continuation of the SSRIs until advised by the doctor to taper off. So this was all about today's session, and we are conducting our paid sessions as well. So if you are interested, you can send us email or direct message. If any one of you has